We now think of obesity as a disease because it has a cause, it has specific symptoms and signs, and it harms the body by impairing body functions or damaging cells and organs. Let's start with the causes of obesity. Although a few cases are due to rare single gene mutations, in the vast majority of cases, probably over 95%, there is a multiplicity of factors involved. Evolution has left us with a genetic tendency to reach a certain weight or to store a certain amount of fat. This is called the weight set point or fat set point, and we each have our own set points as we each have our own set of genes and epigenetic profile. The weight we actually reach, or the amount of fat we store, is due to the interaction between that genetic tendency and our environment. An inappropriate environment can override this set point, as seen by the exponential rise in obesity in the past 60 years, which is far too short a time for any significant change in our genes, but which has seen an astronomical change in our environment, especially our food environment. Evidence has been building for many years regarding the hugely detrimental role of ultra-processed foods and refined carbohydrates. This was set forth in detail by Dr. Chris Van Tulleken in his book Ultra-Processed People, and was recently the subject of a special series in The Lancet. I'll talk about the food environment in a separate video. Suffice it here to say that there is a strong chronological relationship between the rise in the availability of ultra-processed foods and the rise in obesity. And while the big food companies will strenuously try to evade this question by claiming that association is not causation, the objective evidence against these foods is already strong and continues to mount. Other causes must also be considered, as obesity rarely has a single cause. We need to look into lifestyle factors such as sedentary lifestyle, stress and sleep quality, as well as other illnesses, medications and changes in the body such as inflammation and alterations of gut health and of the gut microbiome, though it can often be difficult to determine which is cause and which is effect. External factors such as pollution from pesticides and certain plastics have also been implicated, as they can disrupt appetite signalling. The symptoms of obesity are increased hunger and decreased fullness or satiety. These are experienced as persistently intrusive thoughts about food, that term we often hear nowadays of food noise, and also the need to eat more to feel full. Together, these lead to increased appetite and increased food intake. The sensations of hunger and fullness are not under conscious control, meaning you can't think yourself unhungry or think yourself full. Rather, they arise in areas of the brain that developed early in evolution and are involved in maintaining life. Just like the drive to breathe, these sensations can be resisted for a short while, but eventually the urge becomes overwhelming. The disease of obesity develops when the intensity of these sensations is abnormally altered, with increased hunger and decreased fullness. The degree of susceptibility to these sensations is determined genetically and is influenced by our environment. The environment triggers the hormonal and nerve signals that act on our appetite centres in the brain. In this case, the environment refers to things like the sight, smell, taste, and the amount and types of the foods we eat, also our gut health and gut microbiome and our fat stores and metabolic status, as well as our physical environment, which affects how much we need to move. The main sign of obesity is weight gain due to increased fat storage. More subtle signs include changes in our eating behaviour and in our activity levels, which are also influenced by the appetite centres in the brain. Let's look for a moment at the consequences or complications of obesity. They fall into three groups: psychological, mechanical, and metabolic. Psychologically, people living with obesity can develop anxiety, low self-esteem, and mood changes that can lead to depression. These can sometimes be driven by feelings of guilt, provoked by the stigmatization of obesity and by the social and professional exclusion experienced by people living with obesity. Such feelings can themselves provoke weight gain and can interfere with treatment. Examples of mechanical complications are joint pain, heartburn, and obstructive sleep apnea. And the metabolic complications include diabetes, heart, kidney or liver disease, gallstones, and even cancer. There are too many to list here, as obesity can affect any body organ or system in many different ways. The main aim of the treatment of obesity is to restore and maintain health. And yes, weight loss is a part of that process. The fundamental pillar of treatment is a suitable diet and lifestyle. Other treatments, from behavioural therapies and medical nutrition programs to pharmacological or even surgical approaches, are tools to help you when the symptoms of obesity make it difficult to tolerate and maintain a suitable, individualised dietary and lifestyle approach unaided, or when there is a greater urgency. Additional treatments may also be needed in the short or long term to treat the complications of obesity, such as medication to lower blood pressure or to control the blood sugar levels. We must always keep an open mind on the treatment approach, as some therapies can become less effective over time and need escalation to a more intensive option, or, as the disease comes under control, it may be possible to withdraw more intensive therapies with their higher inherent risk of side effects. Apart from a healthy, balanced diet and lifestyle, no treatment for obesity should be considered lifelong by definition, except of course surgery, which is irreversible in most cases. It may happen that some people need additional treatments for a more or less prolonged period, but the long-term aim should always be to enable patients to maintain physical and mental health and a stable weight on diet and lifestyle alone, without medication and without specialist diets. In summary, obesity is a complex disease that is difficult to control and that can lead to complications, some of which may be serious. Recognition of obesity as a disease is important as it helps to reduce stigma and the feelings of guilt experienced by many people living with obesity. However, it does not mean that we don't have a responsibility to act, because obesity does have consequences. It's the duty of your healthcare professional to help you find the optimal treatment approach to restore health. Treatment must be based on an assessment not only of obesity, but also of the complications that it may have provoked, and must always take into account the personal situation, personal preferences, and the balance of risk and benefit. The essential component of every program is a suitable diet and lifestyle adjusted to each phase of treatment and to long-term maintenance. Behavioural approaches, specialist diets, and pharmacological or surgical methods are tools to help you stick to that diet and lifestyle or to aid in the control of the complications of obesity or other illnesses. These treatments should only be continued as long as they are required and remain effective. Thank you for watching this video. I hope you found it helpful.